After years of being told a COVID vaccine would be treated like a flu shot, where most people should get a booster once a year, the recommendations now changing.
Robert F. Kennedy Jr. announcing today that he is removing the recommendation for healthy children and pregnant women. Your reporter Alan Janae is looking into the new guidance.
The COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule.
The announcement about the COVID vaccine came in a video with Robert F. Kennedy Jr. and the heads of the Food and Drug Administration and the National Institutes of Health joining him.
It's common sense and it's good science.
There's no evidence healthy kids need it today.
In Denver, pulmonary and critical care physician Dr. Anuj Mehta was skeptical.
I think the new CDC guidelines, there's a lot of dimensions to it.
Dr. Mehta said his own family gets boosters.
For both kids and for pregnant women, it's really important to be thinking about the robust conversations with their healthcare providers about what's safe, what's effective, and more importantly, what's going to prevent potential long-term consequences. And I think that the COVID vaccines repeatedly have been shown to be incredibly safe options for adults, for kids, and for pregnant women.
One of our amazing nurses, Barb.
At the practice of pediatrician Dr. Michael Malobsky, with many hundreds of COVID vaccinations dispensed, he has seen no problems.
No one has come back to this office and shown us an issue that we can identify as caused by the COVID vaccine since we've been giving it out.
He made a video explaining to people why he requires parents to get their children most vaccines to utilize his practice.
I have a very large population of medically complicated children.
To not threaten them, other patients have to be vaccinated for things like measles and polio, but not COVID.
When people ask me what I think, I said, I think you should do what makes you feel comfortable. But if your kid is completely healthy and is a completely normal child, I can't quantify for them how much more from a severe infection the COVID vaccine protects them versus not.
It's another thing for children with risk factors. Then he does recommend the COVID vaccine. For pregnant women, a National Institutes of Health published study of the effects on hundreds of thousands of women who have received the vaccine concluded that there were no safety concerns. Dr. Mehta says what's worse is COVID.
That's the thing that's going to put the baby at greater risk, is getting a severe COVID infection, more so than the vaccines at any time.
The CDC's Advisory Committee for Immunization Practices typically weighs in on changes and makes a recommendation. Now, Kennedy did not wait for their recommendation to move ahead. If pregnant women or families with children want to get the vaccine and want insurance coverage, that insurance coverage is typically tied to what that advisory committee says. So what will happen here about insurance coverage is not yet clear. In Denver, I'm Alan Janae, covering Colorado First.
Certainly something we know a lot of people will be watching, and of course we will continue to cover. Alan, thank you.